welcome to yet another video by Light Touch Strategic. The topic for this video is understanding the spectrum of disability. By the end of the video, you will get to have a clear understanding on visible disabilities, invisible disabilities, neurodiversity, psychosocial disabilities, chronic illnesses, and the intersectionality of this. We will wrap up with importance of awareness for inclusion. Stay tuned. Understanding the spectrum of disability involves recognizing the diverse ways in which disabilities manifest, including both visible and invisible forms, as well as the unique experiences of individuals with neurodiversity, psychosocial conditions, and chronic illnesses. 1. Visible disabilities. These are disabilities that are apparent or easily noticeable by others, often due to physical characteristics or the use of assistive devices. Examples include mobility impairments, such as using a wheelchair or cane. Visual impairments like using a white cane or guide dog. Hearing impairments like using hearing aids or sign language. While visible disabilities are more easily recognized, individuals may face stigma, discrimination, or assumptions about their capabilities. Invisible disabilities. These types of disabilities that are not immediately apparent to others, often because they do not have obvious physical markers. Examples include chronic pain conditions like fibromyalgia, arthritis, mental health conditions like depression, anxiety, PTSD, cognitive or learning disabilities such as ADHD, dyslexia, chronic illnesses like diabetes, Crohn's disease, among others. Individuals with invisible disabilities may face skepticism or lack of understanding from others, as their conditions are not visibly apparent. They may also struggle with accessing accommodations or support. Neurodiversity. Neurodiversity is the concept that neurological differences like autism, ADHD, dyslexia are natural variations in the human brain rather than deficits or disorders. Examples include autism spectrum disorder, ASD, attention deficit hyperactivity disorder, ADHD, dyslexia, dyspraxia, and other learning differences. Neurodiversity advocates emphasize the strengths and unique perspectives of neurodivergent individuals, promoting acceptance and inclusion rather than trying to fix or cure these differences. Neurodivergent individuals may face difficulties in environments that are not designed to accommodate their needs, such as traditional educational or workplace settings. Psychosocial conditions. These are conditions that affect a person's thinking, feeling, behavior, or mood, often impacting their ability to function in daily life. Examples include depression, anxiety disorders, bipolar disorder, schizophrenia, post-traumatic stress disorder, PTSD, among others. Psychosocial conditions can be episodic or chronic, and individuals may face stigma, discrimination, or barriers to accessing treatment. The invisibility of these conditions can also lead to misunderstandings or lack of support. Chronic illnesses. These are long-term health conditions that may not have a cure and often require ongoing management and treatment. Examples include diabetes, multiple sclerosis, MS, chronic fatigue syndrome, CFS, lupus, vitiligo, Crohn's disease, or ulcerative colitis. Chronic illnesses can be unpredictable, with symptoms that fluctuate over time. Individuals may face challenges related to managing their condition, accessing healthcare, and dealing with the impact on their daily lives and relationships. Intersectionality. Overlap. Many individuals experience overlapping conditions or identities that can compound their experiences of disability. For example, a person with a chronic illness may also experience psychosocial challenges, or a neurodivergent individual may have both visible and invisible disabilities. Intersectionality also considers how factors like race, gender, socioeconomic status, and sexuality intersect with disability, influencing access to resources, discrimination, and societal attitudes. Importance of awareness and inclusion. Understanding the spectrum of disability requires recognizing the diversity of experiences and challenges faced by individuals with disabilities. This includes acknowledging both visible and invisible disabilities, as well as the strengths and contributions of neurodivergent individuals. Creating inclusive environments involves designing spaces, policies, and practices that accommodate the needs of all individuals, regardless of their disabilities. This includes providing reasonable accommodations, fostering a culture of acceptance, and challenging ableist attitudes and behaviors. This is on the importance of inclusion. Having a basic understanding on the spectrum of disability, we can move towards a more inclusive and equitable society that values and supports the full participation of all individuals on an equal basis. That's a wrap for this one. Thank you for following. Till next time,